Dunkley.
Thank you very much, Deputy Speaker. I'd like Hansard to note that I'm about to be sarcastic, so I don't know if there needs to be italics or an asterisk, but Member for Fisher, if only the 775 members of Montville had been represented by someone in a federal government, had been represented by someone in a federal government for 10 years. Maybe if they'd been represented by someone in a federal government for 10 years, which didn't want to attack Medicare every time the word was mentioned, which didn't want to freeze Medicare bulk billing incentives, which actually listened to the advice about 60-day dispensing and introduced it in the targeted, staged way that this government is introducing it, with allowances for pharmacists in country towns like Montville, which means that in the first year dispensing revenue that might be lost from 60-day dispensing will be offset, and then over 4 years it will step down. Maybe Montville would still have a GP and still have a pharmacist. And a newsagent. Yes, thank you, Member for Boothby. So instead of coming into this place and somehow or other pretending that a government that in its first 12 months has done more to reduce the cost of going to the doctor and the cost of accessing pharmaceuticals than the last 10 years of multiple Liberal National Party governments, maybe instead of doing that, if the member for Fisher actually properly engaged with the needs of his electorate, they wouldn't be in the situation that they're in. In my community of Dunkley, we have a priority primary care centre. We have an urgent care clinic that was started by the state government and is now 100% funded by the federal government, as we promised we would do before the election. There's one in Dandenong, there's one in Frankston, which is my electorate, there's one in Paran and there's one in Narre Warren. And already, since the federal government has taken over funding or established those clinics, they have collectively treated over 20,000 people, according to the South East Melbourne Primary Care Network. Every day I'm getting feedback to a local from Dunkley who needed to access a GP after hours, and now instead of having to wait hours and hours and hours at the admittedly excellent Frankston Hospital emergency room serviced by excellent practitioners, people in Dunkley can now go to the Priority Primary Care Centre and get help for the sprains and the head knocks and the stomach bugs that they need when they need it, and they can be bulk billed. And when members of the coalition, such as the member for Fisher, doubt the commitment of people on this side of the chamber to Medicare, which is how he opened his contribution, doubting our commitment to Medicare and pharmaceuticals, I just say be very careful what you say. We have a caucus over here of people who have served their communities as doctors, as nurses, as nurse practitioners. We have a community of people in this caucus who understand what it's like to have to go and get a script filled every 30 days, who understand that the difference between $30 for a prescription and $42 or $43 for a prescription, when you have to get 5 or 6 prescriptions at the same time, is a massive cost of living measure, is a massive health measure. We represent communities where people don't take medicine that they need because they can't afford it. The changes to the cost of medicine introduced in January, the changes to the bulk billing incentive freeze, the changes which will mean that not only can people pick up their prescriptions every 60 days, they can go to the doctor less, and they can pick up their prescription for every 60 days for half the price, are good for consumers. And consumers of the health system are, by definition, people in need. Pharmacists will survive. Doctors will do better. But you know who will absolutely be better off? people with not very much money who are vulnerable and in need, and they're the ones we're here to protect.